Hi everyone. One question I get a lot is how many repetitions and how many sets should I be doing for each exercise? And the answer is actually really important. So I wanted to share that with you today. My name is Dr. Gretchen. I'm a physical therapist and multiple sclerosis certified specialist. And I created this page specifically so that I could share my expertise in order to help you champion your life with MS. When it comes to the number of repetitions or sets that you should be doing for exercise, the most important thing is quality. And not every exercise is going to be the same level of difficulty for you. If you are doing an exercise that is challenging, you probably cannot do as many repetitions that are good quality as an exercise that is easier for you to do. Therefore, your stronger and weaker leg will likely have a different number of repetitions and sets that you'll be doing. The reason quality trumps everything is because if you have poor quality with your exercises, then what you're actually doing is training your brain to respond to bad quality. Therefore, if I am trying to improve my ability to feed myself with a fork, the ideal movement would be this. However, if I am practicing this over and over again and it's really challenging, so my arm starts doing this, then my brain thinks this is the movement that I want to happen, when in fact, this is the movement that we are working for. So you have to have perfect quality in order to improve the activity you are working on. The most common exercise that I give a lot of people who have MS or other mobility issues is the ankle dorsiflexion. So this is an exercise where you're sitting down, this is your heel, these are your toes, and you're slowly lifting your toes up and then slowly lowering it down. Now, for some people, this exercise is really challenging. And on their weaker leg, they can only do about 5 repetitions before, instead of good quality, it turns bad quality. And instead of coming straight up, it starts rolling a little bit, or it's just not coming up off the ground at all. So on their weaker side, I would suggest do as many as you can with perfect quality and then stop. And then on your stronger leg, same thing. Do as many as you can with perfect quality and then stop. And what you might find is that while the weaker leg can do 5, the stronger leg maybe can do 15. With both sides, you then do a second set. And maybe on your weaker leg, your second set is 3 repetitions. And then you do a third set after a rest break, and maybe it's 2 repetitions. It doesn't matter how many sets you are doing. The cumulative effect of doing perfect quality is what's most important. Therefore, you might find that on your stronger leg, you're actually able to do about 50 repetitions throughout 5 different sets. Maybe it's 10 times 5 sets, and that's perfect. But on your weaker leg, maybe you did 30 repetitions and it took you 6 sets to get there with rest breaks in between. That's great too. Another thing to keep in mind is every exercise will be different. For that same person that had a lot of difficulty doing ankle dorsiflexion, they might do a marching exercise that is much easier for them. And therefore, you can do more repetitions before your first rest is up. Now, if you're the type of person who is looking for numbers, the general rule of thumb that I suggest is to do 30 repetitions perfectly. And that can be 10 times 3 sets, or maybe your first set is 10, your second set is 8, your third set is 5, your fourth and fifth set are 3. And the reason that they're declining is because the quality is suffering a bit. It doesn't matter how you get to 30, but just shoot for 30. If 30 is easy for some exercises, go for 40 or 50 or 60. You are the best person to know how it is feeling for you, and therefore how many repetitions you should be doing and how many sets you should do. So to recap, number 1, perfect quality. Number 2, do as many repetitions as you can with good quality, then stop and rest. And for sets, you want to do that as many times as you can. So at some point, you will feel like, yeah, I just can't do this as well anymore, or this is not good quality, I should stop, or this isn't good movement, it's hardly lifting, I should stop. So that's the number of sets that you should do. And number 4, shoot for between 30 and 50 perfect quality exercises. And if you're interested, I have an online MS wellness program called The Missing Link. In this program, I have filled it with tons of MS-specific physical therapy exercises that are geared towards helping you get stronger, improved balance, better flexibility, and better walking. If you're interested in getting access to those exercise videos, check out the link below where you'll find a behind the scenes into the program so you can see if it would be a good fit for you, as well as the sign up page. If you enjoyed this video and found it valuable, please remember to press the thumbs up button, share with a friend, and press subscribe. And if you have a few extra minutes, these are some videos you might enjoy.